Chapter 4, Common Reproductive Issues. Here is a list of some common menstrual disorders: amenorrhea, dysmenorrhea, dysfunctional uterine bleeding, premenstrual syndrome, premenstrual dysmorphic disorder, and endometriosis. When looking at these words, we can break them down into their individual vocabulary. Meno means menstrual related. Metro means time. Oligo means few. A means without, none, or the lack of. Ragia means excess or abnormal. Dys means either not or painful. And rhea refers to flow. Common women's reproductive disorders includes not only menstrual disorders, but also infertility, contraception, abortion, and menopause. Amenorrhea is the absence of menses during reproductive years. There are two types of primary amenorrhea. The first is the absence of menses by age 14 with absence of development of secondary sexual characteristics. The second is absence of menses by the age of 16 with normal development of secondary sexual characteristics. Secondary amenorrhea is the absence of menses in women who previously menstruated that is related to another condition or disorder. Think about the following question. Is this statement true or false? Primary amenorrhea occurs in women who have previously menstruated regularly. The answer is false. Primary amenorrhea is the absence of menses by the age of 14 with the absence of secondary sexual characteristics, or the absence of menses by the age of 16 with normal development of secondary sexual characteristics. Secondary amenorrhea is the absence of menses for 3 cycles or 6 months in women who have previously menstruated. Etiology and types of dysmenorrhea. Primary dysmenorrhea is due to the increase of prostaglandin production. In secondary dysmenorrhea, we see that it is caused by pelvic or uterine pathology, or endometriosis. Endometriosis is the most common cause of secondary dysmenorrhea. Think about this question. Is the following statement true or false? Endometriosis is the most common cause of secondary dysmenorrhea. The answer is true. Secondary amenorrhea is most commonly due to endometriosis. Primary amenorrhea is related to increased prostaglandin production. Nursing management of dysmenorrhea. Nursing management of dysmenorrhea includes a nursing assessment and client education. During a nursing assessment, past medical history, sexual history, menstrual history, and a bimanual pelvic examination will be done. The manifestations of dysmenorrhea should be explored. Symptoms may include pain, nausea, vomiting, diarrhea, fatigue, fever, headache, dizziness, bloating, water retention, weight gain, muscle aches, food cravings, and breast tenderness. Client education of dysmenorrhea includes comforting measures such as heat, lifestyle changes, and pain relief. Dysfunctional uterine bleeding. Dysfunctional uterine bleeding is similar to and may overlap with other uterine bleeding disorders. Dysfunctional uterine bleeding occurs most often at the beginning and the end of menstrual cycles. The etiology of dysfunctional uterine bleeding is related to hormonal disturbances. The treatment often involves treating the underlying cause. Nursing management could also include client education. Premenstrual syndrome. Premenstrual syndrome includes a wide range of recurrent symptoms. There is also a more severe variant called premenstrual dysmorphic disorder, or PMDD. The etiology of PMDD or premenstrual syndrome is unknown. However, therapeutic management can help. Therapeutic management often uses a multidimensional approach, including vitamin supplements, dietary changes, exercise, lifestyle, and medications. Here are some common treatments for PMS and PMDD. Lifestyle changes, such as reducing stress, exercising 3 to 5 times each week, eating a balanced diet, increasing water intake, decreasing caffeine intake, stopping smoking, limiting the intake of alcohol, and attending PMS support groups. Vitamin and mineral supplements are also helpful, including daily multivitamins, vitamin E, calcium, and magnesium. Medications that are often taken or prescribed include aspirin, low-dose oral contraceptives, antidepressants, anxiolytics, diuretics to remove excess fluid, progestins, gonadotropin-releasing hormone, and danazol. Categorizing premenstrual syndrome symptoms. Symptoms may include irritability, tension, and dysphoria, including anxiety, cravings, depression, hydration, or other. When premenstrual syndrome includes mood disorders, this could actually be indicative of PMDD. Think about this question. When assessing a woman for premenstrual syndrome, which of the following would the nurse be least likely to find? A. Irritability, B. Tension, C. Dysphoria, or D. Weight loss? The answer is D. Weight loss. The woman with PMS typically reports weight gain, not weight loss, along with irritability, tension, and dysphoria. Endometriosis. The etiology of endometriosis includes risk factors, but the exact cause is unknown. Therapeutic management includes surgery and medication. Symptoms that go along with endometriosis are often infertility and pain, nonspecific pelvic tenderness, or tender nodule masses that can be located on uterosacral ligaments, the posterior uterus, or posterior cul-de-sac. Nursing management of endometriosis includes education, healthy lifestyle habits, and support groups. Infertility. Infertility can be primary or secondary. A person might have cultural expectations for reproduction. The impact of culture, ethnicity, and religion on perceptions and management of infertility should be taken into account. There are multiple known and unknown factors affecting fertility. There are separate risk factors for males and females. Therapeutic management for infertility issues can include drugs or surgery. Fertility assessment. Male factor assessment includes semen analysis, sexual characteristics, external and internal reproductive organ examination, and digital prostate examinations. Female factor assessments include ovarian function and pelvic organs. Laboratory and diagnostic testing can also be used, including home ovulation predictor kits, clomiphene citrate challenge tests, hysterosalpingograms, and laparoscopies. There are several treatments for infertility. Clomid, or clomiphene citrate, is a non-steroidal synthetic anti-estrogen used to induce ovulation. Human menopausal gonadotropin, or HMG, also known as Pergonal. This drug induces ovulation by direct stimulation of the ovarian follicle. Artificial insemination is the insertion of a prepared semen sample into the cervical or intrauterine cavity. Artificial insemination enables sperm to be deposited closer to where fertilization can occur, and this improves the chances of conception. The sources of sperm could be the spouse or a donor. In addition to drugs, there are also assisted reproductive technologies, such as in vitro fertilization or IVF. In vitro fertilization, oocytes are fertilized in the lab and then transferred into the uterus. IVF is usually indicated when there is tubal obstruction, endometriosis, pelvic adhesions, or low sperm counts. Another assistive reproductive technology is gamete intrafallopian transfer, or GIFT. In GIFT, oocytes and sperm are combined and then immediately placed in the fallopian tube so fertilization can then occur naturally. This requires laparoscopy and general anesthesia, which does increase the risk. Another technology is intracytoplasmic sperm injection, or ICSI. In ICSI, one sperm is injected into the cytoplasm of the oocyte to fertilize it. This is usually used for male infertility. Another technology is to use donor oocytes or sperm. Eggs or sperm can be retrieved from a donor and the eggs can be inseminated. Resulting embryos are then transferred by in vitro fertilization, or IVF. This is recommended for women who are 40 years or older with poor egg quality. Pre-implantation genetic diagnosis, or PGD, is a process used to identify genetic defects in embryos created through IVF before pregnancy. This is done specifically when one or both genetic parents have a known genetic abnormality, and testing is performed on an embryo to see if it also carries genetic abnormalities. Another procedure is gestational carrier, or surrogacy. In surrogacy, laboratory fertilization takes place, and embryos are transferred to the uterus of another woman who will carry the pregnancy, or intrauterine insemination can be done with the male sperm. Medical and legal issues have resulted over the true ownership of the resulting infant. Management of infertility includes education, anticipatory guidance, stress management, and counseling. The nurse should always show proper respect for the couple and assist in the decision-making or advocacy, as well as assisting with financial strategies. Tips for managing dysmenorrhea. Exercise to increase endorphins and suppress prostaglandin release. Limit salty foods to prevent fluid retention. Increase water consumption to serve as a natural diuretic. Increase fiber intake with fruits and vegetables to prevent constipation. Use heating pads or warm baths to increase comfort. Take warm showers to promote relaxation. Sip on warm beverages such as decaffeinated green tea. Keep your legs elevated while lying down, or lie on the side with your knees bent. Use stress management techniques to reduce emotional stress. Practice relaxation techniques to enhance ability to cope with the pain. If you smoke or drink, stop smoking and decrease alcohol use. Contraception, behavioral methods. Behavioral methods of contraception include abstinence, fertility awareness, withdrawal or coitus interruptus, and lactational amenorrhea method. Fertility awareness methods include cervical mucus ovulation method, basal body temperature, symptothermal methods, and standard days methods. There are also barrier methods for contraception, including condoms, diaphragms, cervical caps, and contraceptive sponges. Think about this question. Which method would the nurse identify as a barrier method of contraception? A. Basal body temperature. B. Transdermal patch. C. Diaphragm. Or D. Symptothermal method. The answer is C. Diaphragm. The diaphragm is a barrier method of contraception. Basal body temperature and the symptothermal method are fertility awareness methods. The transdermal patch is a hormonal method of contraception. Hormonal methods of contraception include oral contraceptives, commonly called the pill, injectable contraceptives, transdermal patches, vaginal rings, implantable contraceptives, intrauterine contraceptives, and emergency contraceptives. There are also surgical sterilization procedures for contraception. This includes tubal ligation, which is sterilization for women. In tubal ligation, a laparoscope is inserted and the fallopian tubes are grasped and sealed. Vasectomy is sterilization for men, usually performed under local anesthesia. This involves cutting the vas deferens, which carries the sperm. When choosing a contraceptive method, several factors should be taken into account, including medical history, family history, OBGYN history, personal history, diagnostic testing, and of course, a physical exam. Medical care providers can participate in decision-making of contraceptive methods to use. It is important for patients to educate themselves. There are many misconceptions. Understanding the mechanisms of actions, disadvantages and advantages, and danger signs of each contraceptive method are important factors to consider when choosing a contraceptive method. Patients should also be aware of method failure and have a backup method. Abortion. There's surgical abortions and medical abortions. Medical abortions are brought about using drugs, methotrexate followed by misoprostol, or mifepristone followed by misoprostol. The impact of menopause on the body. Menopause has a profound effect on the body. In the brain, menopause produces hot flashes along with sleep, mood, and memory problems. Menopause affects the heart by lowering levels of HDL and increasing the risk of CVD. During menopause, bones lose their density and there is an increased risk of osteoporosis. Menopause causes the breasts to have duct and gland tissue replaced by fat. Menopause can also cause genital urinary issues such as vaginal dryness, stress incontinence, and cystitis. Menopause can also wreak havoc on the GI tract because less calcium is absorbed, which increases fractures. Menopause causes changes in the skin. The skin can become dry and thin due to a decrease in collagen. When a woman is transitioning into menopause, it's important to have screening for osteoporosis, cardiovascular disease, and risk for cancer. Menopausal women should undergo positive lifestyle changes and plan strategies to prevent chronic conditions from forming. Nursing management includes health maintenance education, risk reduction, lifestyle modifications, and stress management. Thank you for watching.